there.
Hey, how are you doing today?
I'm okay.
Doing good, great. Okay, so just to start off, how's everything is there? Feels good. Everything feels good.
Yeah, it's fine.
Okay, great. So, Miss Jessica, what brings you into counseling today? What brings you in here?
I'm just really stressed out. I feel like I've got a lot going on. I just feel like I have a certain level of, you know, standards that I hold myself to in life, and it's just a lot. I have a lot of stress. I've got a lot of. I just feel like I can't meet my own expectations. I just don't think I'm doing as well as I have before. I'm just tired, and I can't concentrate. I mean, there's just a lot going on.
So, you mentioned the stress. Now, what has caused the stress in your life?
Well, I work a really demanding job right now. I'm in my second year of my residency for medical school.
Oh, congratulations.
Thank you. But it's hard. I'm married, so I'm kind of trying to juggle work and my relationship. I feel like I've just been kind of irritable. And I don't know. I just don't feel like I'm good enough at anything. My husband has been kind of noticing stuff too. I'm just having trouble falling asleep, and I toss and turn. I've just been crying a lot. I mean, there's just a lot.
Okay. Now, with that stress, I'm going to ask you a very serious question, because a lot of times when these stressors come about, we think of things to do to ourselves. And so the question I want to ask is, have you had any suicidal ideations? Have you thought about suicide? To just say, it's suicide.
I haven't really considered suicide before. I do feel like I'm just not happy lately, and I have thought more and more about just what if I was dead. You know, I get mad at myself because I feel like I have every reason to be happy, but I can't get it together. I just can't shake my, I'm just doom and gloom.
Now, you said that you wish that, you were dead. How often, that's a pretty interesting word to describe it. Now, how many times are you thinking, like, I wish I was dead? Like, is it 20 or 30 times, or is it, a day? Kind of tell me the duration of it.
Well, no, I don't think it's anywhere near that.
Okay.
But I think, it's just kind of here and there. Maybe when I'm really stressed, maybe once a week or once every couple months. I don't know exactly how often I've had that thought. It's just kind of something that, and maybe it's more often, but it's not that I want to do anything about it. It's just, I kind of think, what would it be like if I was just kind of went to sleep and didn't wake up again?
Interesting. So you said that you just think about it now, so you haven't actually made a plan or done any of those sorts of things, right? Okay, that's good. Okay, so you talked about you haven't been able to sleep, and you said it's caused your husband to be.
Yeah, I just have had less interest in having sex, and I've had difficulties with the sleep, and my insomnia has been keeping him awake, and because I'm tossing and turning like an hour or two after we go to bed, and he's just worried. He's heard me talking to my friend. I'm crying on the phone, and he wants me to talk to him, but I just feel like I don't want to talk to him about it. I just don't want to open up. I feel like I need to be, the perfect wife. I just tell him everything's fine because I don't want to go there.
Right, I understand. So you feel like you're more able to talk to your closest friend about it other than your husband about it, which, it sort of makes sense, but, in the same time, that's your husband, and if he's concerned, then maybe you should think about talking to him about it, because he seems like he's very concerned, since it's affecting his sleep as well. So, but
you're right.
Yeah, but so tell me about any past substance abuse. I mean, have you do you use alcohol? Do you do any sorts of?
Oh, sorry.
Oh no, you're fine. You're fine. Or any drugs? Are you on any prescription drugs? Tell me about that. Are you on any?
I don't take any prescription drugs,
Okay.
and I've drank socially when I was in college, especially. But now that I'm in my residency, I don't really have time, so I'm not really
Okay.
doing any of that
Okay.
at this point. And I don't have any prescriptions and don't do any recreational drugs.
Well, that's good. Okay, that's good. So, you were talking about medical school, excuse me, and you saying that you just feel like you've been going hard, and you just kind of is it almost like a burnout feeling? And so, do you feel like your life pretty much in that particular? Do you think it has meaning? I mean, do you feel like you going to school and you're saying that you're not performing how you used to? Do you still feel like your life still has that purpose? Like you still feel like you are going to go on and become a doctor?
I mean, I guess it does. I'm doing good work. I mean, I'm just hard on myself, and I know it. It's just sometimes I can't stop it. When I'm with a patient, when I do something, I feel like there's always something I could have done better, could have done more. But I mean, I do think I'm doing good.
So explain. So I wanted to ask you this question. So, and this is just hypothetical. How would you feel if you did not perform? I mean, if you did flunk out of school, would that be significantly? Would that impact?
It would. Yeah, it would crush me. I think it would be awful.
Okay. Well, like we were saying, at least you're coming in, but I think that it is awesome that you are doing all these. It's like you're the epitome of multitasking. You have a husband, and you're in school, and you work. It's a lot to take on. So I want to commend you for even doing that. So I think that is awesome that you're doing all those things. But definitely, that's definitely for something to for me to consider. I think that you're doing, like I said, you're doing an awesome job, and continuously. I think you're doing an awesome job, honestly, and I think that the sleeplessness and all those things that are going on, it happens, when you're in school. I remember being in graduate school and having sleepless nights and all of those things, and I worked full time and I went to school full time, so I understand the rigors of it, but I know that you can make it with I know that I could see you can. I could see you making it, so that's good.
Thank you.
So as far as you said, you did mention that you feel like you're not sleeping enough. Do you feel agitated when you're not sleeping enough?
Yeah, I feel like at work, I'm just not my normal self.
Right.
I'm grumpy. I'm snapping at my coworkers.
Right.
It's just, I feel pretty upbeat and friendly, but I just, I've been calling in sick a lot. And when I call in sick, I just stay home and watch Netflix all day or sleep all day. I just feel kind of down.
As far as your course load, I know we're kind of getting on topic with your course load. How is your course load in these classes?
Yeah.
Is it pretty?
Well, at this point, I am actually in my residency, so I'm working as a doctor.
Yeah, right.
So I'm not going to classes anymore,
Awesome.
but I'm just being supervised. So it's I'm in a large hospital. Yeah. I'm on my feet. I'm running around. Right. It's high stress.
Yeah, I understand. Well, I can definitely, like I said, I had to do my practicum. I had to do my supervision hours, and I understand completely how it is. But like I said, you can make it through it. I know you can. I know you can but I think that it sounds like to me like you prioritizing your time and getting time in order, I think that would really help as well. And it's great that you are talking to somebody about it, like you're talking to your friend, but the notion of you wishing that you were dead and those kind of things that we want to hone that back in, and maybe there's some other outlets for you versus one of the main things, talking to your husband about it or going to a support group or the community center and talking to somebody about it. I think that would really help a lot as well. Just kind of, if you're not ready to talk to your husband about it yet, maybe going to a group, somewhere that's tailored towards what you're going through. Okay. And that's just a little tidbit of information. Okay. Have you felt that there's no way out of your situation? Do you feel like, as far as you being in school and everything, do you feel like there's no way out? Like you have, as far as your residency, you have to do this. You have to.
I feel like it's something I want to do, so it's not like I don't feel like there's a way out. But I feel like I have to do it at the same time to get where I want to be. Right. So I don't. It's not that I don't feel like there's a way out. It's just hard. I think I'm just, like you said earlier, like I'm kind of burned out, and I'm just, I don't know. I think I need to be less critical of myself, and I feel like I've always kind of struggled with just feeling shameful and not being able to, I just don't. I feel worthless sometimes.
I understand. You said you feel hopeless. So do you think that situation cannot be changed? As far as
I think it can. I think some of the things you mentioned, like kind of finding support with my husband. I think those are things that I need to do. It's just one of those things where I don't know if I even really realized that I've been, kind of shutting him out. And you're right. You made a good point. You said something about how, he's worried, and I think he is. It's just sometimes it's easier to talk to my girlfriends because I feel like I think there's a certain expectation that I just want to do everything perfectly. So I want to be, the perfect wife, and doing that, I can't, I don't want to be a mess and, lean on him, but I probably should.
Yeah, you should. I think so. I think that, reaching out to your husband, I think is you enter into a partnership with him. So I think that by you talking with him, I think that will help him out and kind of cure some of his anxiety towards the whole situation because, like you said, he seems like he's frantic. He's concerned. So I think that would be a good thing to just talk to him about it. So do you feel like, as far other than your husband, would you say you feel like you're withdrawn from him, or would you say, or in a sense, or from any other family, or is it just him, or no one at all?
Mainly just my husband. Like I said, with my coworkers, I've been kind of standoffish with them, so I guess that could be seen as withdrawn. It's hard to be too withdrawn when I'm, I have to work with them, but I am. I'm not being myself with them, and so I guess it's with everybody. Right. There's a few, like my one friend I've talked to a lot, but even with them, I'm just not the same right now.
I understand. As far as, have you experienced any rage, any anger, frustration? Desire for revenge or anything? I would imagine.
Not really.
To any of your
professors,
former professors, or
maybe. No, I don't really think rage. I haven't really been angry. I've been angry at myself more than anything, but not really at other people. I've been irritable, but not angry.
Right. So, as far you talked about, you said your behavior has changed towards your husband. Do you think that, I know we talked about earlier about you actually talking to him. Do you think, are you to the point where you just can't talk to him? Or do you? Like,
I don't think it's that I can't talk to him. I just think I haven't. I mean, I think it's something I can try.
Yeah, I think that you should try. You know, it's just my personal opinion. You should try to reach out to him and talk to him, because it seems like, you know, by you talking with him, maybe it can help alleviate some of the stress. I mean, I think that by you talking to him, maybe those feelings of those other qualms that you've been experiencing will maybe, you know, could subside by you just talking it out and reaching out to him. And so that's really what I want you to do for next time when we come back and we want to meet with one another. I want you to give me a feedback on if you were able to talk to him or not. And like I said, there are community groups out there for you as well. You can come and reach out to some of those community groups and talk to some of those women. I don't think that it's a bad thing that you're talking to your girlfriend about it, because at least you're talking to somebody about it. But at the same time, you know, I think that in a more, I guess, in a relationship with your husband, I think it'd be good to let him in on what's going on. And but I really would like to see you next time. I really think that we can work towards, you know, these, maybe coming up with some kind of time management schedule coming through, and, you know, we can break things up, because I don't know if have you tried to do any time management, trying to split up your time or anything?
I mean, my time is pretty scheduled out with work, but I could probably look at some of, you know, some of it more.
I think that's a good thing for next time.
Okay.
I really appreciate you coming in and talking with me about this, and I look forward to hearing about the conversation with your husband.
Thank you.
So yeah, thank you so much.
Thank you so much.
All righty.